Frank, Lapius, I'm returning your call. Oh, you're a little upset. You think that my article maligned primary care physicians? No, come on. I mean, I'm sure you have a fine primary care doctor. What? I'm not trying to shake your faith in the profession. No, what I'm saying, I receive too many complaints about primary care doctors who only write prescriptions and refer their patients. They do little else. So it's expensive and time-consuming for the patients. And I made a little chart up to show you exactly why. For example, here, you can see all this. Now, a patient goes to the primary care physician, and all he's does normally is to write prescriptions and refer patients. He doesn't have time to do a workup or any procedures, because it's easy to simply send the patients out and let the other doctors do the work. Patient has a little urinary retention, some difficulty lifting his left arm, and some pain in the right shoulder, gets short of breath very quickly, and has cardiac arrhythmia, right? 4 things. What's the easiest thing to do? You go to a urologist for the urinary problem, go to an orthopedist for the pain in the shoulder, go to a pulmonologist because breathing is difficult, and a cardiologist because there's some arrhythmia, right? Now, it may take a patient 4 months to get appointments from those 4 specialists. Everybody's very busy, and this isn't urgent. So, after 4 months, this patient's been seen perhaps by all these doctors, and they've done workups in their own specialty, examined the patient, did the imaging and laboratory procedures they thought necessary. Don't tell me there's not repetition somewhere along the line. Now let's assume each doctor does 4 procedures after examining the patients, and that the bill for the 4 procedures in each office is, say, $2,000. By the time you get done with different MRIs and echoes and stuff like that. Now, so, meanwhile, all these symptoms can be explained on the basis of some neuropathy. The urinary retention, the bladder lost its tone, the pain in the shoulder, and the weakness in the arms can be neurological. The reason he's short of breath is because his respiratory muscles are weak, and the arrhythmia, that goes along with neuropathies and neurological. So the proper referral, had the primary care doctor ruled all the other things out and examined the patient carefully, the proper referral would have been to a neurologist. If each of these specialists did $2,000 worth of work, and let's assume the neurologist did $2,000 worth of work, so all in all, $10,000 was expended, and $8,000 was unnecessary. That's what I'm driving at. So the patient was delayed 4 months trying to get appointments, and the system was charged $8,000 additional monies. So I don't know if I've made my point, but why don't we forget this subject and we'll have lunch, okay? Give me a call when you get a chance, and my best to the family. Take care, Frank.